Thank you for joining me to learn about key considerations for self-funded benefit plan implementation. I'm Sarah Flusky, the Chief Marketing and Communications Officer at Nova Healthcare Administrators, and my team works closely with client onboarding to support member education needs and to create customized member materials for our clients. When you transition from a fully insured health plan to a self-funded or level-funded benefit plan, or you're already self-funded and you're simply changing plan administrators, the first step to getting the plan up and running is plan implementation. In this short video, I'm going to walk you through the elements you'll want to understand so you feel poised to ask questions and well prepared to support your plan's transition. If self-funding is a great fit for your organization, you'll benefit from the cost savings, flexibility in plan design, and the customization a self-funded plan offers. Brokers and TPAs make great partners in guiding clients through the transition, but if you aren't working in the benefits industry day in and day out, it's helpful to have a general understanding of the roles and responsibilities in a self-funded benefit plan so you can prepare to support your organization for success through implementation and beyond. So let's dive into what we mean when we talk about implementation. After you agree to use a new vendor, you move on to implementation where you get to know other employees in the organization. This is where you should expect guidance and support from your broker or your new plan administrator to help you understand any new tools that you might have access to and any changes to plan management that might occur because of the switch. As a part of plan implementation, if you haven't met them yet, this is where you should be introduced to the account management team. Whether it's the employer representative or your broker, the account manager is your day-to-day partner at the TPA and that has your back, gets you answers, and investigates challenges. Implementation is the space between sale and go live where the rubber starts to meet the road. First, think about your plan design. Many plans, when they transition from fully insured to self-funded benefits, will leave their plan design as is to get a year-over-year comparison on plan performance and cost. However, self-funding affords the flexibility to make modifications, or if you're a multi-state employer, you can bring multiple state plans together to simplify your benefit packages. Plan design will be a topic of review with your new plan administrator, and a broker or TPA can guide your decision-making related to the plan or plans you'd like to offer when you move to self-funding, including the plan's network, pharmacy benefit manager, and additional point solutions like telehealth. If you're already self-funded and you're changing plan administrators, and if you have the lead time, you can share your claims history with the new administrator. A clinical review of plan trends can help guide recommendations for plan design changes that could better support employees and help manage plan costs. However you choose to move forward with your plan design and implementation, the beauty of self-funding is that you have the opportunity in the future to make adjustments to your plan to address the unique needs and cost drivers associated with your plan. It's worth noting that any changes you make to your plan should align with the way you talk about your plans in your employee handbook. And in a self-funded arrangement, plan sponsors are responsible for providing a summary plan description and a summary of benefits and coverage, which must conform to a template approved by the U.S. Department of Labor. This also includes a summary of material modifications that outlines important plan changes and summary plan description amendments. Plan will need to determine how much the employer or the plan sponsor will contribute and what portion the employee will contribute for each of the plans offered. Typically, brokers or clients work with actuaries to determine plan costs and outline contribution levels. The second item to consider is the budget. Self-funded plans require an employer-funded bank account to make funds available for the administrator to pay claims on a regular basis. Your finance team will want to understand the claims funding and payment schedules. Payment for claims is based on plan eligibility, so it's important to ensure that the HR team or your broker partner is supporting the process to determine plan eligibility. Leaving ineligible members on the plan can result in paid claims for members who are no longer plan eligible. Compliance and regulatory filings are likely only a favorite topic for attorneys and compliance experts, but they're a necessary part of the conversation when it comes to a self-funded plan. For your self-funded plan, you'll want to discuss Section 204 reporting, PCORI fees, Form 1095-C, and Form 5500 requirements, including a conversation about who will provide the data, who will complete the forms, and who will submit the forms. There are great broker, TPA, and compliance partners in the industry that support clients in compiling this paperwork. If this topic gives you pause, consider this as a heads up on some questions you might want to ask your broker or benefit administrator to ensure your self-funded plan is compliant and running right. When a plan transitions from a fully insured plan to a self-funded plan and the plan design stays the same, the only change employees might notice is the logo of the plan administrator on their ID card. However, if you're in a self-funded arrangement and you're changing administrators, it might be more than the logo on the ID card that's changing. If you make additional plan changes, like different medical network or pharmacy benefit manager, new copays or contribution amounts, all of these changes will need to be communicated to employees. It's a customary part of open enrollment that HR, a broker, or account manager for your benefit plan supports providing an overview of the plan design and the employer-employee contributions for each plan. But if you have an opportunity to squeeze in one more education point, explain what's on the medical ID card. The medical ID card is the key to the kingdom. ID cards are chock full of information. If a plan member understands what the ID card shows, they will be better able to communicate with providers and facilities about payment when they seek care. Don't recreate the wheel. Ask your plan administrator or a broker for educational materials to lighten your workload and make it easy for employees to understand their benefits. And there's never a finally when it comes to managing a self-funded plan because learning about cost drivers and claim payments is ongoing and it changes from year to year. Ensuring that you have reporting to identify cost drivers and risks, along with a plan of action to address those costs and risks, is the keys to managing the cost of your self-funded plan. I've been through the process of identifying a vendor before. Salesperson, great. Implementation and onboarding, 5 stars. Account management, poof. Suddenly, this incredible support and guidance is gone. It is important to ask questions about access to account managers and what that looks like when your plan is up and running. The transition from sales to implementation to account management should be smooth, allowing you to build strong relationships across the organization. Account managers will become your main point of contact day to day after implementation, but there are several key players that will get you to that point. During the RFP and finalist stages, you have the opportunity to ask the plan administrator about their implementation project plan from notice to go live. Ask for an outline of an onboarding plan that identifies key milestones and communication touchpoints necessary to ensure a clean plan setup that will transition into a well-functioning plan. A dedicated implementation manager will play a key role in fostering trust and providing ongoing support to get your plan set up for success. Understanding the implementation timeline and getting status updates can help create transparency, clarity, and ensure that all stakeholders are on task and on time. From reporting requirement checklists to plan build documents, minimizing tasks, setting expectations, and clearly outlining responsibilities will ensure the project continues to move forward smoothly and efficiently. It's not uncommon to have concerns about transitioning to a self-funded health plan or changing plan administrators. It's important to acknowledge any issues, pain points, or concerns upfront. Whether it's conforming to ERISA or ACA standards, supporting employee communication and education, or identifying opportunities to manage the cost of your plan, your broker and your TPA partner should be prepared to support your needs internally or through their robust network of industry experts. When it comes to implementation, I cannot stress enough the importance of planning, communication, and ongoing support you should expect as your plan is set up. Brokers and implementation teams are instrumental to success. Their expertise and dedication to client service are essential. Partnership, a well-documented timeline, and outlined roles and responsibilities are crucial to ensure a smooth implementation and establish transparency in the project. Only by working together can a TPA partner deliver a client with exceptional results. Thank you for joining me today to learn more about some key considerations for self-funded plan implementation. To learn more about Nova, visit novahealthcare.com. On social, you can follow us on LinkedIn or Twitter. You'll find more educational videos from Nova through our YouTube channel. And if you're looking for member education, check out our podcast at Under the Coverage, wherever you listen to podcasts. Thank you.